My favorite thing about the Baby Scripts program was that it saved my life and my daughter's life.
So Megan was a patient of our practice who initially was low risk and qualified for Baby Scripts. At the beginning of her third trimester, she began to feel unwell and was able to monitor her blood pressure and weight at home and noticed that her blood pressure was much higher than it had been previously.
When the trigger went off on the morning of the 17th of April, my blood pressure was very high. I got a email from Baby Scripts within 5 minutes of taking my blood pressure and got a phone call 10 minutes after that telling me to recheck my pressure and that my doctor would be in touch.
The elevated blood pressure for Megan was a trigger because we had set certain standards for Baby Scripts to alert us if patients' blood pressures were over certain values. So we were alerted that a blood pressure had been taken that met these criteria. We were then able to reach out to Megan and to see how she was doing.
They had called me and told me to get to the hospital's, I guess that's the labor and delivery triage. They told me to go there to get checked out, and that's when they found out that I had preeclampsia, and so I was admitted to the labor and delivery unit, and then at 4 o'clock I had a C-section and had a 1 pound 15-ounce little girl.
Once she arrived at the hospital, the elevated blood pressures were confirmed as well as some lab abnormalities, and at that time she was admitted to labor and delivery and then soon delivered based on her condition.
There were no other indications physically that there was something wrong.
If we didn't have the information from Baby Scripts, we would not have been able to have the same level of suspicion for the reason for her symptoms, and so we may have considered alternative management such as an office visit or something before bringing her into the hospital directly.
Baby Scripts saved my life and my daughter's. We would not be here if it wasn't for the app.